Welcome to Induce with Care, where we dive into everything related to labor, birth, and induction. I'm your host, Nikki, and today we're talking about labor induction, what it means, why it's done, and what you can expect if it's part of your birth plan. We'll break down the basics to provide a little clarity on the matter, whether you're anticipating an induction or whether you simply just want to know more about it. So let's start with the fundamental question: what is labor induction? Labor induction is the process of stimulating uterine contractions before natural labor begins. So the main goal is to start labor in a controlled way when it hasn't begun naturally or when continuing the pregnancy is riskier for the mom or the baby. Induction can involve medications, physical techniques, or a combination of both. Now, this doesn't mean that induction is immediate or that it always follows a specific timeline. In fact, inductions can take hours or even days depending on how your body responds to the methods being used. So, there are several medical and elective reasons why your labor may be induced, but regardless of the reason, the key is to understand that this is a common and safe medical practice. It's important to have open conversations with your healthcare provider about why induction is recommended to you, and we'll talk about these reasons later. Why would someone need an induction? Well, there are several reasons, but they mainly fall into two categories: medical necessity or an elective induction. Let's first talk about the medical reasons. Induction is often recommended when there's a risk to the mom's health, the baby's health, or both. For example, post-term pregnancy. So when a pregnancy goes beyond 41 or 42 weeks, the placenta can start to deteriorate and the risk of complications increases. Induction helps ensure that the baby is delivered before any true risk arrives. Now, I know what you're going to say. Well, my mom's friends, girlfriends, brother-in-law's, dog walkers, babysitters went to 43 weeks and her baby is fine. And well, while that might be true, it's probably not. You'll hear a lot of women, especially in the boomer generation, make this claim. And I'll tell you right now, ultrasound technology hasn't been around as long as you think. So it's probably more likely that her due date was just off. But regardless, the goal is to prevent post-date complications before they become a problem. So you can deliver at 43 weeks, but your risk of delivering a stillborn drastically increases by then. So why would you want to take that chance? Gestational hypertension and preeclampsia. Now, these conditions involve high blood pressure during pregnancy, which can be dangerous for both the mom and the baby. Now, I am downplaying that a lot because there is a lot more to those conditions than just high blood pressure. I already have an entire video planned out for hypertensive disorders of pregnancy. Just know that induction may be recommended to avoid complications like seizures or stroke. Gestational diabetes. Now, if your gestational diabetes is well managed, your doctor might just let you labor. But if your diabetes isn't well managed, your baby may grow larger than usual, leading to complications during vaginal birth. Now, again, this is the watered down version because diabetes can also have some pretty serious complications, but induction allows for a controlled labor experience. Fetal growth restriction. Now, sometimes the baby isn't growing as expected, and the placenta may not be providing enough nutrients. In such cases, delivering the baby early might be the safest option. Other reasons can include low amniotic fluid, placental issues, or premature rupture of membranes, and that's when your water breaks, but you don't go into labor on your own. Now, let's touch on elective induction, and I can already feel daggers from the natural birthing community. But this is when induction is requested or planned without a specific medical necessity, usually around 39 weeks. Usually, moms schedule elective induction when they're just sick of being pregnant. But some moms may opt for an induction for other reasons. For example, if they live really far away from the hospital, they want to ensure they give birth in a controlled setting and not on the side of a highway. Understandable, right? Elective inductions are always done in consultation with your healthcare provider to ensure that it's the safest option for both you and the baby. Now that we've covered the reasons for induction, let's talk about how labor is actually induced. So there are several methods, and your doctor or midwife will decide which one is best for your specific situation. But these methods can be divided into two main categories: medical interventions and physical methods. So let's start with the medical interventions. Let's start with the big dog, Pitocin. This is by far the most common medication used in labor induction, and it is also by far the most controversial. But Pitocin gets a bad rep because every terrible labor outcome is blamed on Pitocin. But hear me out. But Pitocin is a synthetic form of oxytocin, and oxytocin is the hormone that naturally triggers contraction in your body. It's given through the IV, and your healthcare team will adjust the dosage to ensure that contractions are productive without being overwhelming. But Pitocin does make your contractions longer, stronger, and more productive, and some babies just don't tolerate long, strong, productive contractions. But some of these babies, the problem is not necessarily the Pitocin that they don't like, it's the contraction. So it does beg the question, would these babies tolerate regular contractions if labor started on its own without Pitocin? And we'll never know the answer to that question. Pitocin is definitely overused in the medical community, but it's an individualized thing. So I definitely would not put in your birth plan that you don't want Pitocin at all for induction, because sometimes it's very necessary to keep the labor going, particularly in cases like when your water break, the labor haven't started on its own. Because if you don't keep your labor going, you're setting yourself and your baby up for infection, and that might actually have a worse outcome than Pitocin alone. The use of Pitocin is on a case by case basis, and that's where having a doula who understands the process can really come in handy to help you decide whether or not Pitocin is right for you. Cervical ripening agents. So sometimes the cervix isn't ready for labor, and this is known as an unfavorable cervix. In such cases, medications like Cervidil or misoprostol might be used to soften and open up the cervix, helping it to become more favorable for labor. Cervidil looks like a little flat tampon and it goes behind the cervix, and the medication kind of melts into it to soften and ripen the cervix to help it open up. Now, misoprostol, or Cytotec as it's also called, is another medication. It comes in a pill form and it's given either orally by mouth or buccally, which means in your cheek. You let it melt between your cheek and your teeth, or it's given vaginally. Misoprostol is also a very controversial medication because it's the same misoprostol used in medical terminations. But I can tell you that the dose of misoprostol for induction of labor is very, very small. It's 25 micrograms to 100 micrograms compared to about 400 to 600 micrograms for terminations. So a very tiny dose and has a very tiny effect. Membrane sleep. This is a physical technique that a healthcare provider can perform during a vaginal exam. What they do is they sweep a finger inside the cervix to separate the amniotic sac from the uterine wall, and that can help release hormones to stimulate contractions. And I know what you're going to ask, is it painful? And the answer is a hard maybe. It's definitely not a comfortable practice by any means, but if you can tolerate vaginal exams, it wouldn't be as bad. If you can't tolerate vaginal exams, having your membrane swept will not be a pleasant experience for you at all. However, whether or not it will cause actual pain is up to you and your individual pain tolerance. Now for the physical methods. Now, an amniotomy. An amniotomy is when they break your water. So if your cervix is partially dilated, but labor hasn't started yet, your doctor may perform an amniotomy to break the amniotic sac, which releases fluid and it also triggers contractions. Does it hurt? Again, it's a vaginal exam with an amnio hook. And I say hook because, well, it is a hook. It's a hook. But I would aspire to more of like a crochet hook and not like Captain Hook. Foley balloon catheter. So this is another mechanical method where a small catheter is inserted into the cervix and is filled with saline to create a balloon. So the balloon simulates the baby's head to put mechanical pressure to open up the cervix to about 4 to 6 centimeters. And it's a great labor cheat, and it literally cuts the induction process in half. It's often used in conjunction with other induction methods like a cervical ripener or Pitocin to help the cervix open up. Again, does it hurt? Maybe. I personally had a balloon when I was induced for my second child, and I won't lie, it's not the most comfortable experience. It's a lot of pressure down there, but I was able to sleep through the night, and when I woke up, I was 5 centimeters. So your doctor may opt to do this as an outpatient procedure, meaning you'll have it done either in the office or in the hospital, and then you'll go home with the balloon inside and then come back either when the balloon naturally falls out on its own or in 12 hours, whichever comes first. Each of these methods has its pros and cons, and your healthcare provider will discuss the best approach for you in your specific situation. The key is knowing that the induction is a process and that can take time. And it's all about encouraging your body to move into labor at a pace that's safe for both you and your baby. So now that we've covered the methods, let's talk about what to expect if you're going through an induction. First of all, it's important to understand that the labor induction can take time. Some women go into labor in a few hours, while for others, it can take a day or more for their cervix to fully dilate and for active labor to begin. The induction process often starts with a check in at the hospital. So once you're there, your healthcare team will monitor your baby's heart rate and your contractions. After that, they'll usually check your cervix to see how open, thick, and soft it is. Now, a thin, soft, low cervix is the most ideal for labor induction. But if your cervix is closed, thick, high, and firm, then it isn't ready for labor, and your doctor may start with a cervical ripening agent or a mechanical method like the Foley balloon. Once your cervix is favorable, Pitocin is often used to trigger contractions. But you'll likely be connected to monitors and you'll receive updates from your healthcare team on how things are progressing. Now remember, labor can be unpredictable, even with an induction. Some women progress quickly, while others may need more time and more patience. It's important to stay flexible and open to changes in your birth. And as your doula, my role is to support you emotionally and physically throughout this entire process, helping you to stay calm and comfortable. Now, don't be afraid to ask questions. It's your birth experience, and understanding what's happening will help you feel more empowered and more confident. For a lot of women, the fear of the unknown is the worst part of the process. Some women don't realize that it's supposed to take a long time, and they think that something is wrong with either them or in their body or their baby, and that's what's making everything slow. But I'm telling you right now, plan and expect a long process if you're being induced. If your labor is super fast, I want you to be pleasantly surprised. In fact, if your labor is 6 hours or less, you are the anomaly. You are the lucky one. You are God's favorite child. You're a unicorn, and women everywhere hate you. I'm just kidding. So to wrap it up, labor induction is a common and effective way to bring your baby into the world when natural labor hasn't begun or when there are medical reasons to deliver your baby early. Understanding the process and the methods involved and what to expect can help you feel more prepared and confident if induction is a part of your birth plan. If you're facing an induction, it's normal to feel a mix of emotion, whether it's anxiety, excitement, maybe even some fear. Know that you're not alone. Your healthcare team is there to support you, and as your doula, I'm here to guide you through every step with emotional, physical, and informational support. Thanks for tuning in to Induce with Care. I hope today's discussion has given you a lot more clarity and reassurance about the whole labor induction process. If you have any questions, feel free to reach out. And as always, if you found this episode helpful, please share it with other moms to be. See you next time and take care.